Today, when a couple cannot have a child, doctors usually examine both partners. In the ancient world, the woman was often blamed first. She might be given strange medicines, exposed to smoke and strong herbs, sent to pray at a temple, or replaced by another wife if none of it worked. But ancient people were not completely ignorant about infertility. Some already understood that the problem might come from the man, the woman, or both. The difficulty was proving it. There were no hormone tests, microscopes, or scans. So, healers looked for signs they could see: irregular menstruation, pain, unusual discharge, or anything they believed was wrong with the womb. Many thought pregnancy failed because the womb was blocked, too dry, too cold, or sitting in the wrong position. Their treatments followed those beliefs. A woman might be told to change her diet, drink herbal mixtures, take hot baths, or use medicines placed directly inside the body. Some treatments involved fumigation. Herbs or other substances were burned beneath the woman while the smoke rose toward her body. Healers believed this could open the womb or restore the right balance inside it. Other medical texts describe probes and instruments being used when doctors believed something was physically blocking conception. A few remedies may have helped with certain infections or symptoms. Many probably did nothing. Some could have caused burns, pain, or even made the problem worse. When medicine failed, however, the search did not end. It moved to the gods. A couple might visit a temple, offer gifts, make a promise to a deity, or sleep inside a sacred healing sanctuary while waiting for a dream that explained what they should do next. To ancient people, this was not necessarily a choice between medicine and religion. They could try both. A healer might prescribe herbs during the day, while the same family prayed for divine help that night. But what happened when the medicines failed? The prayers went unanswered, and years passed without a child. At that point, infertility stopped being only a medical problem. It became a family problem. In societies where marriage was expected to produce children, a husband might divorce his wife, marry another woman, or have children with someone else. The woman could lose her position in the household even when there was no proof that she was the infertile partner. Other families chose adoption. In ancient Rome, adoption was not always about taking in a small orphan. A man without children could adopt an older boy or even an adult man to carry his name, inherit his property, and continue the family line. That tells us what ancient infertility was really about. Of course, many people wanted a child for the same emotional reasons people do today. But a child was also an heir. Without one, there might be nobody to inherit the land, care for aging parents, continue family rituals, or preserve the family name. Ancient people tried to treat infertility with the knowledge they had. When medicine failed, they asked the gods. And when the gods failed, they changed the family itself. The harshest part was not that they lacked modern fertility treatment. It was that someone, usually the woman, was often forced to carry the blame for a problem nobody could truly understand.